You are listening to Scott H. Silverman's Happy Hour, a podcast released on the first 3 Wednesdays of the month. Family crisis, relationship crisis, addiction crisis, no two crisis situations are the same. They vary by family, individual, and relationship. They can encompass complex family dynamics, emotional distress, anger issues, and entitlements, and often involve substance abuse. This podcast addresses these issues and others surrounding the addiction epidemic currently plaguing this country and the world. There is hope and help.
Are you stuck, scared, or unsure of what to do next? If a situation with a loved one, spouse, or even a child has started to spiral, possibly becoming dangerous or threatening, it's time to seek help. My name is Scott H. Silverman. I help families navigate crisis situations. I'm the person you turn to in order to get you and your loved ones unstuck.
Welcome back to the show. This is Scott H. Silverman's Happy Hour, and I'm Michael Glenn Moore, Scott's co-host. Scott, how's your week going?
My week is better now that we've seen our guest that's been out in the sun, obviously, and got some exposure. And obviously Congress right now is taking some easy days out, but he'll explain how he got that sunburn from yesterday being
Are
present.
you having any of the fires close to San Diego?
No, they're north of us right now.
Okay.
Yeah, north and the northwest, there's a lot of fires. We've had our share in San Diego. My goodness, we certainly have. But right now it's still dry though, and high temperatures. So the wind's been a little mild. So hopefully it doesn't pick up. But no, my week's been pretty good, and been looking forward to today and talking to an old friend and old colleague, and one of my look up tos in the world. So anyway, we'll get started. So hi, I'm Scott Silverman. Scott H. Silverman. Look me up, because the guy without an H lives in Japan, and every time he gets my emails, he gets upset. I mention that when I can. Welcome to Happy Hour. Today we have probably the most famous guest we've ever had. So be sure and take a deep breath on that one, Congressman Peters. And I'm going to read a couple things about the congressman, but I know Scott Peters when he was city council, and I knew him when he was just a dad, when we were sitting next to each other when our kids were playing softball. And I remember he asked me one day, he says, "What do you do?" I says, "Oh, I work with the homeless." And he goes, "Really? Why?" And I talked to him, and we've been friends ever since. So I haven't seen you on Girard though, walking in. You work out at the that, what is that called? That Orange place, I think, the Orange Gym, or
no, the Orange Theory. No, I for COVID, I found myself at a gym where no one else could go, and paid a lot of attention to that.
Yeah, well, and I heard the 3 of the Texas Democrats that just went back to DC were tested positive in the news this morning. So anyway, let's talk about Congressman Scott Peters served the California's 52nd Congressional District, which includes the cities of Coronado, Poway, most of northern San Diego. First elected in 2012, Scott has worked across the aisle to fix the broken Congress and stand up for San Diego's military and veterans community. Scott Peters currently serves on the House Budget Committee, House Energy and Commerce Committee, as well as the Joint Economic Committee. What that basically means is he's roughly down to a 90-hour week, and he does everything he can to get it all done. He's a civic leader who's made improving the quality of life in San Diego his life's work. I know because I've witnessed it personally. After a 15-year career as environmental lawyer, Scott was elected to San Diego City Council, where he later became the city's first city council president. On the council, Scott helped lead the $2 billion redevelopment of downtown San Diego, the cleanup of the city beaches and bays, and the completion of a number of major infrastructure projects. Also pursued greater accountability and efficiency in government through the creation of new council mayor form of government with an independent budget review function. In 2001, the governor appointed Scott to the Commission on the Tax Policy and the New Economy. And in 2002, the Speaker of the Assembly appointed Scott to the Coastal Commission. Scott's also served as the chairman of the San Diego Unified Port District, a major economic engine that supports over 40,000 high-skilled, high-wage jobs for San Diegans with a $3.3 billion in direct regional economic impact. During his time in Congress, Scott's passed legislation to give the military advanced technology it needs to fight terrorism, to level the playing field for small businesses competing for government contracts, and has succeeded in getting the federal government to make changes to the homeless funding formula that disadvantages the San Diego, ranked the 4th most independent Democrat in Congress by the National Journal. There's a lot here to read, and you probably get.
That's probably enough.
Yeah, well, I'll stop there. Thank you.
Make
Anyway,
me think I'm old.
well, you're seasoned, experienced,
Yeah.
but more importantly, you're committed, and that's what's real important. So, with that, ladies and gentlemen, I'm going to ask Scott to tell us a little bit about himself that he wants to share, and maybe give us kind of a glimpse of what you think people want to know in this sphere of our influence. And
Sure.
we have a little over 6,000 downloads now with our podcast that Michael has helped put together. And Michael, by the way, he interviewed me about a year and plus ago, and then said, why don't we do something together? And we've been doing this every week ever since. So, and you are our biggest VIP. So we're excited to hear the band playing in the background, and hors d'oeuvres will be served, well, sometime after this new remasking goes on. So Scott Peters, Congressman, it's all yours. Take it away.
Well, it's very kind of you to have me, Scott. Thank you very much. And it's true, I have been back in San Diego, but since the pandemic is kind of opening and people are coming out again, we've gotten in the habit of just accepting every invitation because it's been delayed. And so a couple of them have been military events outside, and I thought I was prepared, but obviously, I got to start paying attention to that again. Look, I really like my job. I like everything about it, but the commute, I feel like for me, working in a legislature like Congress is an opportunity to solve problems, to use my skills I developed as a lawyer, and to think about, my skills as a city council member, where we used to work very closely with both the public and each other, and bring some of that to Congress. And I'm still trying to do that. And now we're in a situation where we ought to be in a position to bring stuff to the floor, because Democrats are in control of what comes to the floor. And so I would like to see more progress. And I think we're kind of looking at September 30th as the end date, when the government has to be refunded. And that's kind of when things will start to turn toward politics, I think, again. So anyway, you've been really helpful to me. I want to just say thank you for all the work that you've done in addiction and helping me understand kind of what some of the challenges are. We've taken a swing at a couple things because I've got exposure in two ways. One is I'm on the Energy and Commerce Committee, which is the committee with jurisdiction over a lot of things. One of them is healthcare. And so we've taken a little bit, I can tell you a little bit about the work we've done to try to do prevention, which you've always identified as the first step, to push back on some of the over prescriptions for opioids in particular as painkillers. And then we've really worked on veterans. So there's 235,000 veterans in San Diego County. We're a big military town that leaves a lot of veterans here. We try to make sure that they have job opportunities when they come out, that they have good health care at the VA. But some of them fall on hard times. And as you know, they're overrepresented among the homeless population and the addicted population. And those two are very, very closely tied together. So we try to work on that.
So tell me, I'm going to go back to your last part of your point that you think September 30th is, this is going to be tongue in cheek. September 30th, you guys are going to, kick into first gear and really move forward, accelerate but aren't there a lot of rumors right now that potentially Trump will be coming back in August?
Oh, yeah.
I mean, I hear that it is amazing to think about, something like that taking place. But I'm glad to hear that, because I know that this has been, I can't imagine, the work that has to be done. And you've always been one of those cross the aisle kind of people. And, I kind of grew up in the nonprofit world the last couple of decades. So I was really apolitical and never really took a position because of the intent was it would, create some problems with donors. So it's baffling to me to watch what goes on and the time it takes and the simple things that they appear to be simple from the outside, but the bureaucracy that you have to live with. And the other thing I want to mention before I go to your questions is, did you get in trouble when you came home with that sun on your face? Because I know if I get sunburned, my kids go nuts and they go, better, and don't use that stuff. I don't know, whatever the recall right now for one of the big sunscreens. So that's all we have in the house. My daughter says, don't go out in the sun till you get some new sunscreen. So, okay.
Well, let me spend a little more time on your podcast talking about my skin tone. I get red pretty fast. And where I took grief was when last time I went back to DC and I had been outside and they said, what are you doing here? would you go to Hawaii or whatever? No, I said, this is where I live. I take more grief from folks in DC about enjoying the outdoors than here. But I think it's actually, I didn't mean to misstate it. I think we have to get everything done before September 30th.
Oh, okay.
Politics kicks in.
Very
because
good.
people
All
are
right.
going to start to turn their attention to winning the majority in the House and the Senate. And so it's going to be a really busy few weeks. And we're talking a lot about kind of how to affect the safety net. I can tell you a little bit about in the committee, the thing we learned about opioid prescription. You may know about this.
Yep.
So there's when you get a knee replacement, say, or some operation like that, your providers often reimbursed through what's called a bundle payment. So they'll give you, if you're the doctor, they'll give you a certain amount of money to cover the cost of the equipment, the knee replacement equipment, the operating room time, the time to pay the nurses. You get a bundle, and then whatever you don't use, you get to keep as profit. So you have an incentive to keep the cost down, and that makes a lot of sense. But part of that bundle has been post-operative pain relief. And the way that works then is you're incentivized to choose the absolute cheapest thing, which is opioids. A little bottle full of those pills costs $20. And what that means is that there's not a lot of incentive to develop alternatives to opioids for pain relief. And
right.
We've done things like make sure that you get smaller prescription. But even was cleaning out some drawers, and I found a bottle. There's probably 12 of them left of something codone, whatever you probably know what that is.
Oxycodone.
So it's like for 3 years old, and so there's overprescription. But the more fundamental things, there's no financial incentive to provide an alternative. So what we decided to do is we introduced a bill called the Postoperative Opioid Prevention Act, or the POP Act, that would take pain relief out of that bundle payment and pay for it separately. And we would say also, we would pay more, not $20, maybe $100, maybe $150 for an alternative that wasn't addictive. And that would, set off a whole range of effort in the private sector to come up with something that they could sell that would be different from opioids. And, I know you're dealing with a lot of overprescription stuff, and some of that's down to the ethics of doctors and providers. But a lot of it's because there's no alternative. So we'd like to help identify alternatives in the market.
And there's major discussions now about potentially replacing the opioid prescription with potentially medical marijuana. And there's no science that says that's going to work. Right. But, as a footnote, Safe Homes Coalition, which is a nonprofit that I run, helps families dispose of unsafe and unused medication. Because what you have in the home right now, you can't flush down the toilet because you know where that's going to go. And you can't really put it in the landfill because then the seagulls will pick it up. And then you got seagulls that are all oxyed out flying around San Diego, bopping into people's, sliding glass windows. But no, I think that's great. And if there's anything I can do to help with that, it's powerful. Because, in 2016, 264 million prescriptions of opioids, Oxycontin specifically, were written. And according to the CDC and the DEA, and no one really knows, it's anecdotal, 61% of those prescriptions still sit in medicine cabinets. Right. Because a lot of people take what they need and they go, I'll keep this for later. And what we're seeing right now in the overdose family of morbidity is young people who are taking counterfeit medication that's disguised like a Xanax. And that's cut with fentanyl, which is even worse than Oxycontin. Right. And that's where the overdoses are coming up. And, the big articles last week just said it's up over 30% from a year ago. And I'm going to be with them tomorrow in the studio, actually through Zoom, talking about that 30% increase. And San Diego has had a 400% increase in overdoses in the last year. And that information comes right from the medical examiner. So it's not even it's not Sandag, it's not a study, it's just data that the medical examiner is sharing right now.
Well, I think also, you'd be able to, in a position to tell us how much people's mental health has been affected by this pandemic. It's been really life altering in a lot of ways. And, I know people not necessarily turning to substances, but there's been a lot of more demand for mental health services and things like that. So we really multiplied it over the last few years. And so I think that the need is even greater now.
Right. And what's fascinating is the experts in the field of behavioral health, I don't care where they sit, state, federal, county, private practice, solo practitioners, no one has seen this phenomenon of the lockdown. So people, that the issues, alcohol sales were up 70% through last July. We don't know what it's been the last, 6-9 months, and everything's going up and the need for it. And, and kids, younger kids who have been home from school, the internet addictions continue to rise. And now as they go back to school, hopefully this fall, with one form or another, we're going to see them coming with new tips and tricks they learned on the internet, because the internet highway, unfortunately, has just, it gives everybody tips. You just Google, hey, what do I do? My mom's yelling at me, blah, 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 go get some Xanax, do this, do that. And that counterfeit medication piece, and, has been an issue. But, before I forget though, do you have a favorite book that you're reading right now close by that you might want to share with our viewers?
The Opioid Pandemic by Scott H. Silverman is.
Thank you.
All
right. Michael, I think that's it. We'll just wrap up the show.
Shameless, Scott. I'm surprised.
I am rereading East of Eden by Stein.
So anyway, let me ask you, thanks for sharing that. And, by the way, that book, I think I mentioned before we jumped on, I sent to every governor in the country, every single one with a nice note. And only 6 have sent me letters thanking me. I sent one to the vice president, sent one to the president. So if you're talking to anybody, at NIDA or, at CDC or at some level, and go, you want a subject matter expert whose passion is to help save lives and avoid funerals. I mean, anything I can do is just, we're just not talking about it, and we need to be talking about it. So tell me about, let's jump into the veteran piece, discuss some of the related bills that, help veterans, suicide, threat assessment, the Stand Up Act. I know you're involved with that, the Sergeant Daniel Summers Network of Support Act. Talk a little bit about that and what your involvement's been.
Sure, a few things. And one of the nice things about, so this is my 5th term in Congress. So I've been working on some of these things a long time. And when I first was elected, my first term, I was very frustrated I couldn't get a particular bill passed. And Linda Sanchez, who'd been around for a long time, she says, Congress is a long game. You have to be patient. And I said, well, I'm not talking about doing it this month. I'm talking about October. She says, no, term after term. So some of these things have cooked over a long time. But early in my service, I met Howard and Jean Somers. I don't know if you've heard of them. They are residents of Coronado. They had lived in Arizona, and their son got caught up. He had served 2 tours in the Middle East as a captain and dealing with confidential information. And he was really hurting, and he got caught up in that issue with appointments in the VA in Arizona, and ended up taking his own life. Daniel Somers. One of the problems was since he was dealing with classified information, he couldn't do group therapy because he couldn't talk about what he knew. And so one thing we've adjusted is to make sure that people in that situation can get individual attention. But we've also introduced the Daniel Somers Network of Support Act. And the thing that Gene is his mom and Howard is his dad. Howard was a urologist, so they're familiar with the medical world. But the thing they pointed out to us, which was so important, was that peer support was really important for these guys. And they did not know, as Daniel went through his journey in the Army, what Daniel was going through. So what we did was we came up with this network of support idea that when you sign up, if you enlist or join the military, you'll be asked for the 6 to 10 people who you would like to know, you'd like to let know what's happening to you. And at a minimum, they will get an email that says Scott is deploying to this place, or he's been assigned to this, these are his duties, so that they can check in on you and you can have contact with them. We're doing that out of the VA and also out of the Department of Defense, because we think that's I'm sure you know that peer support is really important for these folks who go through a particular kind of thing that maybe counselors or their neighbors would know about, and that's been passed, and we now know that if the people who are signing up now will have a network of support that they'll designate that certain sharing of information can happen with. We also found that there was a huge bureaucratic issue around marriage and family therapists for veterans. So if you were licensed by the state of California to be a marriage and family therapist, but you weren't licensed by the federal government, you might not be able to go across the street and work on at the VA and work on veterans issues. So we dealt with that licensing issue. That was an easy one. We're also trying to get rid of this notion that PTS, or post-traumatic stress, is a disorder. We've issued a resolution to rename it injury, because we want mental health injuries to be understood in the way that physical injuries are. And then the other big mental health thing I'll just tell you about that we are really proud of that's passed, and I think will become law, it's passed the House twice now, is the Stand Up Act. I went to Coronado Heights Middle School. And these are, what are they, 6th, 7th graders, 8th graders, and they have developed this web of care for each other, working with Sandy Hook Promise, the group that came out of the shootings at Sandy Hook in 2012. And they are committing to take care of each other in a way that's really, I think, very, very profound, and was very, very amazing to see when I went out there. Our bill, and there's this big dispute now, is a stupid dispute in Congress over gun safety. I'm an advocate for background checks, and I don't see why we have to have weapons of war out on the streets. And when those weapons get in the hands of the wrong people, then people get killed. But among many Republicans, it's just sort of there's nothing that they'll do. They say it's a mental health issue. Well, it's both a guns access and a mental health issue, because a responsible gun owner who doesn't have mental health issues isn't going to shoot up a church. And a person with mental health issues who can't get a gun isn't going to shoot up a church. It's both of them together. So the thing we did was we at least met the Republicans where they were on this Stand Up Act and said, well, if it's a mental health issue, let's do what we can to prevent it. And it turns out that something like 80 or 90% of people who do these awful things, these kids that you read about who just come out one day and go shoot up their school or the movie theater, they tell somebody beforehand that they're going to do it. So all we're doing is we're getting states and schools and tribes to set up sort of a network of support and awareness, so that when these things happen, they can let each other know. It's kind of inspired out of the Coronado Heights Middle School in my district. And that's passed the House. And I think there's no reason why to expect that it wouldn't pass the Senate. It was very bipartisan. Clearly, we have a lot more to do around gun safety and mental health. But this was a way where, you think about what your classmates and your peers can do to prevent and to help out. This doesn't have to be driven entirely by a government program. I think it's so we're very happy about that.
That's really great to hear. And I got to tell you, I don't see many government programs that on a broad scale like that, because it's
right.
Every community is different. Everyone wants to filter the information that they get. And, when you think about it, you talked about it, we call it the social model in the recovery world that I'm in. And, the data around relapse is pretty horrible as far as the outcome goes, but the social model, and peer-to-peer, and we're now serving veterans at Confidential Recovery, which is very exciting. By the way, thank you and your staff for help supporting us put that together. And what we're finding is we're hoping by the end of the year, and I hate to even say this out loud, but we've had some interesting outcomes that we think are very positive, because we're able to, as a boutique operation, do something different than the VA, and the VA is our partner on this. They're making the referrals through the relationship, and we coexist together. But the social model, for example, if you look at the military, you look at first responders, you even look at street gangs, you look at gangs in jail and prison, it's that family, if you will, and it's a difficult word sometimes to associate with gangs. It's working together to help survive. But when they leave the gang, when they leave the military, when they leave as first responders, that continuum of support isn't really there. It's almost like they're holding their breath, and then when their term ends, they're kind of sitting there, and then the families disengage. And if they're suffering from untreated trauma or PTS, they go home and it just gets inflammatory. So, as an advocate for, change and a continuum of care, I think that the government obviously is a powerful tool. You know, the VA, if I'm not mistaken, is the second highest budgeted line item in the federal budget. Yet, you know, and serves, you know, millions of people. And you don't hear a lot about serving the family as well. And the disease of addiction, mental health itself, it is a family that's impacted by it, not just the one person. So anything that we can do to help build that seamless connectivity. So prior to release or prior to transition, the tools are given, and they spend as much time training people to survive in real life as they do training them to survive in a military zone. So we know that there's ways to do it, but making it a priority, earmarking the resources necessary for it, it's going to take a lot of time. It's interesting with the way you framed with the gun issue, because I never really thought of the Republicans looking at it as a mental health issue and Democrats looking at it as a gun issue. Because when you think about it, you're absolutely right. And a DA will tell you in San Diego, to my next question, what percentage of the people that are being arrested are under the influence of something mood altering. It's as high as 95%, and over 70% is methamphetamines. And I know that, you know, you're part of the Methamphetamine Response Act, and I'm not even exactly sure what that is, but as a retired unlicensed pharmacist, and that was my product that I distributed back in the day. Tell us about the Methamphetamine Response Act.
I'll introduce the bill with my friend John Curtis, who's a good Mormon from Utah, a Republican, Senator Feinstein and Chuck Grassley, that would make methamphetamine an emerging drug threat and requires the National Drug Control Policy Office to develop a public plan to combat the addiction. It declares it an emerging drug threat, and that sets in motion some governmental attention to the issue. They're clearly, we're just at the start of that, but the support for that is very bipartisan, and I think warranted. And you mentioned fentanyl, like we were visiting the border, and there's a huge threat from these substances that are just getting cheaper and cheaper while they get more and more powerful. You know, the line between recreation and tragedy is very thin. And you know, I think that we want to make sure that the federal government is on top of that from a regulatory side, but we also have to make people aware, which I know is a focus of yours, and try to prevent these awful accidents from happening.
Yeah, there was a homeless guy interviewed about 5 weeks ago in the local paper, and he's downtown East San Diego is kind of his home on the streets. And he was saying how he has test strips now that when he gets his methamphetamine, he checks to make sure there's no fentanyl in it. So if a homeless person with no resources can do that kind of monitoring on their own, you know, I wanted to find out who he was. I tried to get the reporter to call me. I never got a call back because I want to go meet this person. I want to find out, how did you get the resource? Where did you go find the test strips? What is it we can do to mirror what you've just done? Because kids today who are at parties, you know, they call them Skittle parties, they're taking medication, and it's not drugs anymore. It's now poison. And when you look at fentanyl and you look how poisonous it is, and as you just said, that's what's causing it. And right now the data shows over 240 overdoses per day behind opioids. And the people who really are in the know, the front lines, tell me it's north of 500 overdoses a day. The difference is because we have that miracle drug, naloxone, which is in Narcan, it's reversing a significant amount. So God forbid we didn't have that, you know, and 240 people, in my opinion, is a plane crash. Yet for some reason, it's not something we talk about a lot. And I'm hoping once COVID gets to be quieted down, we can really start to push, you know, and I always get criticized when I don't mention other things like vaping, substance use disorders, alcohol, impaired driving. Those things are all important, but our time's kind of limited today. So Scott, let me ask you this. What have we not asked you today that we should? And then I'm going to issue you a challenge. Then we're going to get to your quote after we have Michael ask his question. What would you like us to ask you that we haven't?
I guess I'm interested in knowing. So here's the thing I would say that you should know is that Congress doesn't generate ideas from within. I talk to folks like you about addiction. I talk to medical professionals about healthcare, and what I'd like to know is what I'd like people to know is that if you're going through something that the government could affect, you're not the only one. we'd love to hear from you about, what you're seeing. Let's say one of the things that we dealt with was the Trump administration put out this idea that they would cut all the veterans assisted supportive housing vouchers, which are the vouchers that you get for housing and supportive services if you're a vet who's on the street with potentially with substance problems. It was the veteran service organizations that told us about how what a bad idea that was. So I guess I'm working on a bunch of things that I think are valuable. I've outlined some of them. I guess what I'd like to know is what we're missing. What's the priority? What works? What doesn't work? Where are we getting the bang for the buck? Where are we wasting our money? That's from your community. That would be really helpful input for us.
Okay. Michael, any questions from you today? And then I'm going to go back to the congressman with a challenge.
I just wanted to know how you feel, or when you're in the House and you approve a bill and it goes to the Senate, how frustrating is it to have it just languish on, the Kennedy's desk or whoever is in charge? Not Kennedy.
Yeah, the leader's desk.
Yeah.
Well, first of all, you have to remember that it's constructed to be slow and deliberative. It's not supposed to be easy, even in the best of times. But it is hard, Michael. I was the city council president in San Diego. There were only 8 of us on the council. I talked to each one of them. I set the agenda. We decided we were going to vote on something on a certain day. We voted on it. It was over. And then I could drive home often and see the progress that resulted from my work. I've had to let go of that a little bit because the things we're talking about are so big. I'm not moving millions or hundreds of thousands of dollars now. Now we're talking about billions of dollars. And so, I understand it's got to be hard, but I put in a lot of work developing relationships with people and trying to know who's expert on what, because each of us has our own field of expertise, and trying to work with them to make progress. And I understand that it's a long game now. So this is my 9th year, my 5th term. And I told my wife, I said, I probably need 2 more years to fix Congress. I keep telling her that. She lets me run again. But I think it's very important. And I know it can be frustrating. And it looks frustrating and it can be frustrating when, you have a common sense idea or something that obviously needs attention and doesn't get handled in the way you want. But I also think that's the reason to keep at it. And I wish there were an easy way to do it, but I think it's important work, and I'm blessed to have meaningful work. I like everything about it except the commute.
Okay, Scott, you said you had something else you wanted to ask him?
Yeah. Well, I want to turn that question that I asked you, what would you like us to, I want to challenge you, and your office is probably the most responsive office I've ever dealt with. And, I've dealt with a couple of legislative leaders, county, city, state, fed. I would like to be your subject matter expert, and I'd like to be it for the country. I want to be at the table, even if it's Zoom. And yeah. I want to be the person, one of the people, at least they call on and talk about it. The fact that all these letters went out to the governors, and I know I haven't seen a state yet that hasn't been concerned about the overdose crisis. And, I know things get sent to you in huge volume, and, life is all about relationships. So my challenge is, I don't want to call you and give you my ideas. I'd like somebody on your staff to help me bring the awareness up wherever and when you can. And then you call me and say, look, Scott, we've got a situation here. Are you available? Right. And let me do what I can to bring my time and talent, to the table. Right. And and I know your team, they've been very responsive. And I know one of them's on our podcast right now. Poor Anthony's going, oh God, he's going to give me more shit to do, but that's okay, Anthony. We'll get through it, brother. And he's been real supportive. So anything I can do for you, and I want to call in a couple of weeks. And if there's an email listserv, by the way, for the governors, that you could alert somebody on their staff to say, did you guys get the book? Did you see it? It's actually, I don't know if you had time to read it, maybe soon. And I'd love to get your input. And be sure and put a nice review on Amazon. That helps with sales. But it is a workbook. It is the tools. It's a GPS. It's a curriculum, and it's put together in a way where if you're a 6th grade student, or you run a multi-billion-dollar company, because this issue if we were to truly take a look at it in a way that we need to, we would all see it's one of the most catastrophic events we have with a trajectory, no sunset. So
Very
with that,
helpful.
with that,
We'll call on you.
please, and don't threaten me, call me. I want that to happen.
Yeah.
So would you close us up with, a thought that we'll all always remember?
I just want to say very simply, if you can be anything, be kind. On two ends of this, we've had a hard time. We know that people have gone through this pandemic, and it has been tremendously upsetting for folks. So, be kind to those people. I have to, in my own household, I know people are affected at various levels of stress. We need grace for each other. And also, I would just say, be kind to yourself too, because if you're going through a hard time, you're not alone. It's been tough for everybody. And there seems to be so much anger out there. And I think that we're not gonna be able to solve any big problems if we're all so pissed off at each other. So try to be kind, and then we can try to work together and heal some big wounds here in this country.